All right, so for the lumbar spine, I'm going to be doing inspection, palpation, and then active range of motion. We're not really doing passive range of motion of the lumbar spine, nor resistive range of motion, nor end feels. So just I'm going to start off with inspection. I'm inspecting to see if there's any redness, any inflammation, edema, hypertrophy, atrophy, and or any pathologic changes such as like a outgrowth or excessive hairy spot or stuff like that. Now I'm moving into palpation. I start with temperature. And then superficial palpation over the soft tissue. Does any of that bother you? Moving into deep palpation. Alright, is that tender?
Yeah,
big. Checking his iliac crest as well. PSIS, sacrum. Alright, go ahead and stand up straight. Now I'm moving into active range of motion for the lumbar spine. So finding T12, putting this top thing of the inclinometer, top leg, between T12 L1, zeroing it out. I'm going to be pulling this down a little bit. Is that okay? And I'm putting the top leg between S1, L, between L12, S1. And I'm going to zero that out. Alright, so go ahead and flex forward as far as you can. And you can go ahead and stop. So he has actually come back up. Neutral. Okay, flex forward, stop. So 15 and 10, so 5 degrees. Normal should be around 40 to 60. So I'm gonna try that again. Maybe I did something wrong. Okay, so T12, that's 1. Zeroing that out. 12L1. Alright, flex forward. There we go, stop. So we have 5 degrees and 30, so 25, that's a little better. Still normal should be between 40 and 60. Go ahead and extend back, come back. All the way back, is that it? Perfect. So we have 50 degrees and 20 degrees, so 5 degrees. Normal should be between 20 and 25. And then what I'm going to do is to assess lateral flexion. Okay, zeroing that out. Put your arms to the side, and then bring your left arm down. Good. 10 degrees, 5 degrees. So you have 5 degrees, and then now bring your right arm down. 10 degrees, 0. So 10 degrees there. Lateral flexion normal is between 15 and 20 degrees. Now for rotation, what I'm going to ask you to do is go ahead and rotate to your right. Alright? Looking at that shoulder, rotate to your left. Okay? In both, he has about 25 degrees. Normal should be between 3 to 18 degrees for the rotation of the lumbar spine. Alright. Okay, so this next test, it's called the Nary's bowing sign. I'm going to have you do, sir, can you stand up and face that way? I'm going to ask you, can you go ahead and put your arms to the side and go ahead and just try to touch your toes? Is that it? Yeah. Okay. So if this is a negative test, if let's say one of his legs, one of his knees bent, bend your knee a little bit, just one. So like that would be a positive. If only one knee is bent and the other one straight, he could be doing that to take pain off or pressure off, and that would be indicative. You can go ahead and relax. That would be indicative of L4 to S1 radiculopathy, most likely L5S1. Okay, so this next test, it's called the heels walking test. So what I'm going to ask you to do is go ahead and place your hands forward like that and stand on your heels. Okay, I'm going to be here to catch you if you think you're going to fall, so don't worry. Just go ahead and walk forward on your heels. Try not to drop your toes. Walk forward. Keep walking. All right, good. You can go ahead and relax. So that's the heels walking test. The test would be positive if his toes would drop. So if he cannot successfully walk on his heels, that would be a positive test. And then that's indicative of an L4 or L5 radiculopathy. Could also be a common or deep fibular neuropathy, as well as a problem with his tibialis anterior or extensiohalis digitorum muscle. All right, so this next test, it's called toe walking test. Okay, sir, so what I'm going to ask you to do is stand on your toes. Stand on your toes, perfect. And I'm going to be behind you to catch you, so don't worry if you think you're going to fall. So go ahead and walk on your toes forward. Walk forward, walk forward. Perfect. You can go ahead and relax. So that's toe walking test. A positive test would be if his heels drop. So if he cannot successfully stay upright on his toes, or if he cannot walk with his toes up, that would be positive. And that would be indicative of an S1 radiculopathy, also a tibial neuropathy, or a gastrocnemius or soleus muscle problem. All right, so this next test, it's called the Braggarts Test. Go ahead and sit with your legs forward, just like that. Do you have any pain in your back, thighs, any numbness or tingling? Perfect. So what I'm going to ask you to do is kick your right leg forward, straighten out your knee. Perfect. Does that cause you any pain? Now do the same on the left. Does that cause you any pain? Relax. Do both at the same time. Pain, numbness, tingling, changing discomfort? No? Okay. So that's a negative test. A positive test would be either pain, radicular pain, or paresthesia in the L4S1 distribution. Most likely an L5S1 radiculopathy would be the indication for it. All right, so this next test, it's called the sitting root test, also known as Slr Test. Pain, do you feel any pain in your low back, numbness or tingling? Okay, so just go ahead and relax. I'm going to do all the work. I'm going to be moving your leg around. Let me know if you feel any discomfort. So, any pain with that? No? All right, I'm going to do the opposite side. Any pain with that? No? So a positive finding would be pain on the elevated leg. That would be indicative for an L4S1 radiculopathy, most likely L5S1 radiculopathy. Okay, so this is called the Sciatic tension test, aka Braggarts Test, or Braggarts sign. Now, this test should be done if I had a positive sitting root test, or if when doing sitting root test, the patient couldn't really well describe his or her symptoms. So I just want to confirm that there's radiculopathy. So I'm going to perform first sitting root right now. Sir, do you have any pain there? No? Okay, do you have any pain there? Yeah? Can you describe that?
I don't know. It just hurts.
Okay, so patient doesn't know, so I'm going to perform the diarrhea sign on this leg because it's the pain, the one that he feels the discomfort. However, he cannot describe it. So I want you to, I'm going to raise that leg up until you feel discomfort. Let me know.
There.
Okay. Now I'm going to bring it down. Is that better?
Yeah.
Okay. So now what I'm going to do is I'm going to traction that leg. I'm going to try to traction that sciatic nerve and try to recreate the pain. Does that cause you any pain?
Yeah.
Yeah? Is it the same pain that you felt when I
Yeah.
raised it? Okay. So now that's a positive test. That's indicative of an L4S1 radiculopathy, most probably L5S1 radiculopathy. All right, so this next test is called the Turin sign. So I'm going to be moving your great toe foot around. Let me know if you feel any pain or discomfort, numbness or tingling. Does that cause you any pain?
No.
Any pain, numbness, tingling there?
No.
No. So, if he felt radicular type pain, shooting, tingling across that leg, that would be a positive test for radiculopathy between L4S1. Okay, so this video, I'm going to be doing the SLR test, also known as the straight leg raise test, as well as the well leg raise test. So I'm doing SLR and well leg raise. So first, sir, you said you came into the office with leg pain. Can you describe your pain?
It goes down all the way back.
Okay, so he has right leg pain that goes all the way down into your feet?
Yeah.
Okay, so first I'm going to be doing the well leg raise test. I'm going to be placing this inclinometer relatively to velocity. Sir, I'm going to be raising your leg. Is that okay? Let me know if you feel pain at all. Let me know when you feel pain, if any. Pain? Is that painful?
Yeah, and this leg.
Alright, so that's painful in your right leg.
Yes.
Okay, noted pain at 50 degrees in his right leg. That's a positive well leg raise test. Could be indicative for an L4S3 radiculopathy, most likely L5S1, in his right lumbar spine. Okay, so now this is the SLR test, straight leg raise test. I'm gonna zero it out. Let me know if you feel any pain.
Yeah.
There. So around 20 degrees. Where's your pain?
Going down.
Going down as well. Both on your right leg. So that's a positive test, for straight leg raise test for L4S1, L4S3 radiculopathy, most likely. Okay, so this is called Braggarts Test. So, inclinometer. Sir, you came to the office with leg pain, right leg pain. Can you describe your pain?
It goes down.
Shooting pain, all the way to your great toe?
Yeah.
Okay, so first I'm gonna do SLR again. On the uninvolved side, let me know if you feel pain at all.
No.
No?
No.
Alright. So I'm gonna do SLR on the involved leg. Let me know if you feel pain at all.
Yeah.
There?
Yeah.
Pain at 25 degrees. I'm gonna bring your leg down a little bit. Is that better?
A little bit. Yeah.
That's better?
Yeah.
Okay. So now that's better, I'm gonna add dorsiflexion. Does that recreate your pain?
Yes.
Yes?
Yeah.
Alright, shooting pain down, or how does it feel?
Yeah, shooting down.
Alright, so that's a positive Braggarts test. Confirms the radiculopathy between L4, S3, most likely L5, S1. Also, if the pain is between 35 to 70 degrees, it could be, radiculopathy anywhere between L4 to S3. Okay, so this next test is called the Fajr-Stein test. So, sir, you said you have pain in your right leg that's shooting down. Okay, I'm going to be doing the well leg raise test on the non-involved side. Alright, so I'm going to zero this out. I'm going to raise the leg. Does that cause you any pain?
No.
I want to make sure nothing is going on. So I'm going to add dorsiflexion. Is that painful?
No. Yeah.
There?
Yeah.
Shooting pain?
Yeah.
On your which leg?
On the right one.
Okay. So now that's a positive hydrosaturn sign. Indicative of an L4S3 radiculopathy, most likely L5 is one. Okay, so this next test is called the bowstring test, also called the cramp test or popliteal test. So you have shooting pain on your right leg, correct?
Yes.
Alright, so first, always start on the non-involved side. I'm going to raise this leg. Let me know if you have any pain.
No.
No?
No.
Alright, I'm going to do the involved side. Let me know if you have any pain.
Yeah.
There?
Yeah.
So pain at 30 degrees. I'm going to bring his knee bent a little bit. Is that better?
Yeah.
Better? Alright, good. So now, what I'm going to do is that better, right? Mm-hmm. Okay, I'm going to traction his popliteal, trying to traction the sciatic nerve. Does that recreate your pain?
Yeah.
Alright, so shooting pain, how would you describe it?
Shooting pain.
Alright, so that's a positive bowstring test. Indicative of an L4S3 radiculopathy, most likely L5 is 1. It could also be an extradural sciatic problem. Okay, so this next test is called the femoral nerve traction test. He complained of shooting pain on his right leg. So I'm going to do the non-involved side first. So, sir, I'm going to raise your leg. Let me know if you feel any pain or discomfort. We can non-involve. Okay, so raising the leg up, no more than 15 degrees because I don't want to be moving his pelvis. Does that cause you pain?
No.
If he said no, I'm going to bend his knee slightly to 90 degrees. Does that cause you pain?
No.
No pain. Alright, so now I'm going to ask you to face that way on your side. Okay, so extending his leg no more than 15 degrees. Does it cause you pain?
No.
Alright, now I'm going to bend his knee. Let me know if you feel any pain.
Yeah.
There?
Yeah.
Okay. Where do you feel pain? On the thigh?
Yeah.
Okay. Can you describe it?
It goes sideways.
Okay. So L2, L3, or L4 distribution would be a positive test for a L2, L4 radiculopathy. Alright, so this next test is called the Eli's heel to buttock test. Patient came in complaining of radicular type pain on his right leg. So I'm going to start with his non-involved leg first. Sir, do you feel any pain with that?
No.
Alright, I'm going to raise it. Pain with that?
No.
Alright, perfect. I'm going to do the involved side. Sir, any pain with that?
No.
I'm going to raise it.
Yeah.
There?
Yeah.
Alright, and can you describe your pain?
It goes down.
Alright, sideways? Or?
Straight.
Alright, so if he had radicular type pain across the L2, L3, L4 distribution would be positive for an L2, L4 radiculopathy. Also, if he was unable to lift his leg up, or if he had non-radicular pain, just like pain in that localized area, it could be because of an iliopsoas strain or a rectus femoris, tight rectus femoris muscle. Alright, so this next test is called the pro knee bending, aka neck class test. So what I'm going to be doing, patient came in with complaining of right leg pain that's shooting down. He doesn't really know how to describe it, so I'm just going to go ahead and do this test to see if I can figure something out. Okay, first I'm going to start with his left leg, non-involved sign. Sir, does that cause you any pain? No pain. I'm just bringing his right heel to his right buttock or left heel to right buttock. Sir, does that cause you any pain?
Yeah.
Yes? Can you describe the pain?
It hurts.
It hurts, you know how? Is it local?
Yeah.
Okay. So, positive findings would be radicular pain in an L2, L3, L4 distribution, and that would be indicative for an L2, L4 radiculopathy. Localized pain or lumbosacral pain would also be a positive. Lumbosacral pain would be something maybe an SI joint syndrome or a lumbosacral facet syndrome. Localized pain could be again like a lumbosacral joint problem or pain in that muscle. So those would all be positive. Okay, so this is Kemp's test. So is it okay if I undo this part? Yeah. Are we done? Perfect. All right, so I'm gonna contact the PSIS, and then I'm gonna cross your hands onto your chest. And then what I'm gonna do is I'm gonna rotate, laterally flex, laterally flex to the side like that, and extend over my hand. Pain. All right, I'm gonna do the same on the opposite side. Rotate, laterally flex, and extend. Pain. Okay. So either an achiness or a localized pain or a radicular type pain would be a positive indication. A radicular pain would be a positive test for lumbar radiculopathy, or if he just had like an achiness in that area, it would also be positive. It might be facet syndrome, capsulitis, a sprain or a strain, or could also be a muscle spasm. Okay, so this next test, it's called the Freiberg's sign. So patient came in complaining of shooting pain down his right leg. Is that correct, sir? Yes. Okay, so I'm going to be performing this test first on his non-involved or left leg. Alright, sir, what I'm going to do is I'm going to internally rotate the leg. I'm going to raise your leg, let me know if it hurts at all. Alright, I'm going to do the same on his involved leg. Let me know if it hurts at all. So I'm going to internally rotate. Let me know. Yeah. There? Yeah. Alright, so about 25 degrees. So now I'm going to externally rotate. Does that feel better? Kind of. A little bit? Yeah. Yes? Okay. So, that would be a positive Freiberg's test, and that's indicative of Piriformis syndrome. So what he feels is radicular pain in internal rotation that's relieved with external rotation. Okay, so this next test is called the Piriformis Test. Patient came in complaining of shooting leg pain on his right side. So I'm first gonna test the uninvolved side, not involved leg. So go ahead, sir. I'm gonna be moving your leg around. Let me know if you feel any discomfort. What I want you to do is go ahead and bend this knee. So keep these legs straight and bend this one. All right, and come a little forward. You come a little forward. There you go. So what I'm gonna do is I'm gonna stabilize his pelvis and push onto his knee, trying to stretch that piriformis. Is that painful? No. No. Okay. So now I'm gonna do it on the involved leg. Face me. I'm gonna do the same. Go ahead and straighten your leg. See. Okay. So stabilizing his pelvis, pushing the knee down. Is that painful? Yeah. Yes? Can you describe the pain? Is it shooting down?
Yeah,
it's shooting down. Shooting down. Okay, so that's possibly a positive test for piriformis, indicative of piriformis syndrome. If he had localized pain right around his piriformis, that's also a positive test and could be a piriformis spasm. All right, so this next test is called the Gainsland's test. So patient came in complaining of pain right around the sacroiliac region on his right. So because of that, I'm going to start on his left. So sir, can you scoot a little bit to the left? On your back. So on your back, just scoot this way. let this leg fall, and then bring your right knee up onto your chest and hold it with your hands and pull it like that. So I'm gonna be stretching that area, stretching that SI. Does that cause you any pain? No. All right. So now I'm gonna do the involved side. Go ahead and scoot this way. Let that right leg out. Perfect. I'm gonna try to stretch that area. Does that hurt?
Yeah.
Yeah?
Yeah.
Can you point to it?
Here.
Alright, so he's pointing to his right SI, and that's a positive test for say sacroiliac joint problem. Alright, or facet imbrication or sprain. Alright, so this next test is called the Yeoman's test. Patient again came in complaining of right SI problems. I'm going to start on his left. Let me know if this hurts. This is your left side, so this leg is not bothering you, right? Just going to make sure. I'm going to pick this leg up like this while pressing on the PSI down. Does that hurt?
Yeah. No.
Does that hurt?
No.
Alright, he's saying no. I'm going to do the same on the involved side. Let me know if this hurts.
No. Yeah.
Okay, can you point to it? Right there, he's pointing to his right SI. So that's a positive test for SI joint syndrome. It could also be an infection or a strain. Alright, so this next test is called the iliac compression test, also known as the approximation test. What I'm going to be doing, sir, is I'm going to be applying some pressure, and let me know if that hurts, okay? So just go ahead and relax like this, that's fine. So I find his iliac crest, I find his greater trochanter. I pretty much go in the middle of it, and then I apply an actual compression, or a downward compression. Does that hurt? No? So, by the way, before this patient came in complaining of right SI joint. Now I'm going to go ahead and turn it to your right side up. Face me. Alright, just go ahead and relax. Alright, again, finding that iliac crest, greater trochanter, pretty much going in the middle of it and applying a downward force. Does that hurt?
Yeah.
Where does it hurt? Can you point to it? Down back there. So he's pointing to the SI, and that's a positive test for some SI joint problem, infection, or strain back there. If I did the test and he said it hurts, but it hurts below, like wherever I'm pressing, that's a negative. It's just, it could be something else. It's a pain provocative. If it hurts in that SI joint, in that SI side, whichever one, that would be a positive test. So this next test is called the Journey's Triad. It's actually a series of questions. Sir, have you felt any pain or change in your symptoms whenever you cough?
No.
How about whenever you sneeze?
No.
How about whenever you bear down? That's it, going to the restroom? No? Alright, so if he answered yes to any of those, or actually if he answered yes to all of those three, that would be a positive test or a positive Journey's Triad. And that could be increased intrathecal pressure from a disc defect, a mass, or some sort of osteo. Okay, so in this video, I'm going to be doing both thigh and leg mensuration. Are you right-sided or left-sided? Right. Okay, so that he's right-sided. Just going to keep that in the back of my mind. So I'm going to find the lateral epicondyle. So I'm going to be measuring your leg and thigh. Is that okay? Okay. Lateral epicondyle. Placing that 0 there. Going to the thickest portion of his thigh. I'm going to go around 8 inches up. And then I'm going to measure, lift your leg a little bit. And he has around 16 degrees. 16 degrees. Then I'm going to go 4 inches down, 3.5. I'm going to go 3.5 inches down from his lateral condyle and measure his calf. Relax. And he is 12.5. Do the same on this side. Again, 8 inches up. Lift your leg up. More. There you go. Thank you. Relax. Alright, so 16 inches, so same. That's pretty good. And I'm gonna be from his lateral condyle going 3.5 inches down. Measuring, lift your leg up. Relax. And 13 inches, which is consistent. A difference of more than 1 inch in either side would be some indication for something going on in his leg, like inflammation or atrophy or hypertrophy or any of that stuff. Or also if his dominant leg was less in a diameter, was like shorter or smaller in size. That would be also positive for muscle atrophy or other conditions in that sort.